Welcome to Health IQ. I'm Dr. Alan Siegel. Today we have a very special guest, Caitlin Policastro. She's an adult nurse practitioner and integrative health specialist at Nusoma Health here in Armonk, New York. Welcome, Caitlin. How are you?
I'm good, thanks.
So, integrative health. Tell us what that means to you and how you approach your patients and your practice.
Sure. So just a quick background. I have been at New York Center for Innovative Medicine for the past 8 years before coming to Nusoma Health, which focused a lot on the root cause of disease. So from a conventional paradigm, we have a very linear Newtonian view in that you come to me with elevated blood pressure, elevated cholesterol, sugar issues. Okay, you're put in this diagnostic box or category, given a medication, we'll check back in with you 6 months to a year from now. With what I was taught is, why do you have those things going on? Why do you have elevated blood pressure, cholesterol, sugar issues? And then how do you treat those from a non-conventional standpoint? So what that means is, for example, if the reason why you have those things going on is your liver a complete mess because you have a high load of infection or heavy metal toxins, or the liver has to do with anger and frustration, do you have a high degree of that type of emotional stress going on? So it's really looking at the patient from a holistic standpoint or view, from every facet: energetic, spiritual, emotional, and physical. So that's number one, finding the root cause as to what's happening and then treating them non-conventionally. The whole purpose of integrative alternative treatment is to give the patient tools or the ability for them to come back to some type of baseline or optimal health, so then your body can recover and take care of itself and you live a very happy life for however long afterwards.
Well, I think that's an interesting approach for sure. Conventional medicine, as we know, typically will treat or diagnose a condition. And based on that condition, a lot of times it's a very reactive, like, let's take this drug, let's do this procedure. I think what you're discussing here, and correct me if I'm wrong, is that we want to find out what caused the problem in the first place, how we can correct it either through diet, nutrition, emotional changes, changes in our lifestyle, and then hopefully having our body sort of naturally heal itself.
Yeah.
So, because I think what patients don't understand is that our body has a very natural, innate ability to heal, and I think what you're describing is assisting and aiding that body's ability to heal, and then looking at, okay, you have these issues, but sometimes giving more medication and more drugs can cause more problems. Right. As we know, like, we all listen to the commercials on TV, and they'll tell you, okay, it treats this, but it has 14,000 side effects. So, okay, you got the one benefit, and you got 14,000 other things wrong with you now because of the medication. Now you're causing more toxicity in the liver because the liver has to process all the medications. So the approach seems like a smart way to do it. I don't think as a society we're taught this, and I don't think as a society we're moving towards that direction. But I do like that preventative, integrative approach that you're talking about. How do you assess your patients? How do you they may come in with a whole host of conditions, because everyone's condition-based, but how do you truly break that down and say, okay, this is what you have, how are we going to approach this?
So, right. So again, just backtracking a little bit. So I come from a background of always asking the why. So not, you have these symptoms, you have this condition, great, let's give you this IV, this injection, why? So again, the example that I just gave you with the cholesterol, the blood pressure, the sugar, let's say. You come to me, of course we do, like you would do at your primary care practitioner's office, a physical, vitals, medical evaluation, lab work, which is helpful. It's a very, in my opinion, tiny piece to the puzzle. When someone has skewed lab values and it's out of norm, to me, that means that something has already physically manifested in your body. A lot of, from the conventional paradigm, it's, let's put you on this medication and you'll be fine within a year. I think the opposite. So I look at trends in lab values, which helps me determine a program of treatment, and also maybe what things are starting to manifest in terms of pattern formation. And then I do an integrative lifestyle questionnaire. So like you just mentioned, diet, sleep, hobbies, work, emotional stress on top of Eastern type of diagnosis. So that means, which some people may be familiar with, pulse diagnosis, tongue diagnosis, which our acupuncturist is phenomenal with. And then using my clinical judgment that I've been doing for the past 8 years, looking at patients from a very integrative, energetic standpoint, in that if you tell me you went to Costa Rica 2 years ago and you had this really weird bout of gut issues, and then you went to Tulum last year and same thing happened, then I would say to the patient, okay, I think you have certain infections going on. These labs are not going to show that. So would you want to get tested for these additional things that I think you should do? You can make that decision along with me. If you trust my clinical judgment, you say, I know what you're talking about, let's just go do the treatment. Or if you want to do the additional testing, we can do that. And then we develop a program of treatment for the patient. Program of treatment is using a lot of, I call it invasive therapies. So when you take something orally, in terms of whether it's medication or supplementation, specifically with supplementation, the rate of absorption is very, I don't want to say poor, but it's very low, because a lot of us have gut inflammation, gut issues. We don't absorb things the way that we should. It has to bypass all of these systems. When you do something IV, when you do something injectable, goes to your system almost immediately. So you're bypassing that whole process. You get that glutathione, that vitamin C, that biotin, that L-carnitine all into your body immediately to help with your metabolism, your liver, your gut, and what we were just talking about, giving your body those tools so it can replenish what it needs to have replenished and detoxify the way that it should.
And heal properly.
Right.
So,
right.
And now the gut health you mentioned, you started going to like some things about where you were and maybe what you might have picked up, some bugs. How important is the GI tract and the digestive system in
it's huge.
In helping
it's
persons heal?
The number one topic of conversation for probably the past, 5 years or more, especially in like the integrative alternative health world. But even from a conventional standpoint, a lot of practitioners are now talking about gut health. It plays a huge role into what we're absorbing via food, which food quality is not the best nowadays. So you're already working against that. But the vitamins, the minerals, the nutrients that you need, it plays a huge role in, issues with neurological symptoms like depression, anxiety, ADHD. It plays a huge role in our overall immune system and health. Your small intestine is your number one line of defense. So it's very vitally important. And we have hundreds and thousands of things circulating through there. It's our number one transit system. So it's working very hard and it has a lot to deal with. So it's very challenging if you're not doing something to support that, to have optimal gut function.
Yeah, I think one of the big things you mentioned is the food quality. The food quality, we all try and eat well. Some of us better than others, but I think some of the ingredients that are in the foods, the processing of foods, the high processing and all the preservatives and all the chemicals that are actually in our food really does over time cause us some problems. And I think trying to teach people how to eat a better, cleaner diet is really important as part of the healing process. It's just something, like you said, digestion, absorption. If we can't absorb supplements, a lot of times people just start taking a lot of different supplements, which I think is great, except for 90% of it may not be absorbed, and then you're really just wasting a lot of time and money and energy trying to take those supplements. It's
tough. It's tough for patients. I feel their pain because patients will say, but I eat so clean, I take these supplements, I exercise, I live a healthy lifestyle. Okay, well, what's the quality of supplement that you're taking? Are you buying it at Costco, or are you getting, for instance, an amazing product that we used to use was Nesmin medication or Marco Pharma or Quicksilver. Those are high quality supplements. Yes, they're more expensive, but are you taking those? Are you eating foods from Trader Joe's that's off the shelves that, anybody can buy? Or you're going to your local farm to get things that aren't sprayed with pesticides and that are organically grown and they're fresh, which all of those things require research and time and effort, but that's what we have to do to promote our health.
I mean, just to reference something, I know this is a little silly, but Consumer Reports even did a study on vitamins, and they actually showed some certain quality of vitamins. I'm not going to mention brands, but you have to be very careful. Some that have high level of metals, high level of, they found arsenic and some other types of rat poison in these types of... I mean,
even baby food. I have an 8-month-old and a 3-year-old, and I refuse to do anything off of the shelves because, again, I forgot the brand, but there was high levels of arsenic in it. You never really know because, like you mentioned, with processing and production and speeding things up to get things out on the shelves, heavy metals is a huge issue, not only in baby food, but a lot of supplements, a lot of foods. And just going off of that, in my old practice patients, again, they would say, well, how do I have a high load of metals in my system? It's not just food, it's water, it's what we breathe, it's medication, it's, for females, makeup. It's where you live. We would get patients from Texas that, a lot of what was in their
environmental
soil.
toxicity, right? Yes, for sure.
So we are working against a lot. 20 years ago, 30 years ago, fine, different story. But sometimes, a lot of times, diet, supplements, even healthy lifestyle, it just doesn't cut it. And your body, like you said, it's extremely resilient and intelligent, and it can handle so much. But think of your body as like a bucket. When your bucket starts to get more and more and more full, it has no choice but to tip over. And that's when you have those alarming symptoms and you say, oh my gosh, I'm so fatigued. I have IBS. I can't get out of bed in the morning. I have these joint pains. I, have these issues with my lab results. You have surpassed prevention. You're now at a state where we have to kind of slowly empty that bucket and get your body back to an optimal state of health.
Well, let's talk about the heavy metals and metal toxicity in general. So how do you evaluate someone if you think they have heavy metal toxicity, and what would you do to help treat them to sort of, like they call the word, like almost chelate them a little bit, right?
So it depends. I like telling every patient, I never treat any patient the same. You're an individual, so you should be treated as such. So every case is different. But even what you just mentioned, that if you have issues with cholesterol and sugar and blood pressure, the liver feeds into the heart, and in men specifically, liver and heart and even kidneys are very much so affected by heavy metal toxins. So let's say you have that. Maybe you have fatigue, some brain fog, and some other symptoms that might trigger in my mind that you have a little bit of an issue with maybe amalgams in your mouth, maybe you're a mechanic for 20 years. Heavy metals is the first thing that comes to my mind. Then we would either, like I said, if a patient trusts me and they say, I know what you're talking about, let's do this IV that has specific components that will help chelate you in a natural way, specifically things, let's say like vitamin C or glutathione. Or calcium EDTA is a great chelator. If a patient wants to go for further testing, we can do something like doctor's data, run a heavy metal test in that regard and see what levels are.
And is that a urine test? That's through the urine?
Yep.
Okay.
So and I would explain all that to a patient, obviously, but and then it depends to what metals a patient is off on. Some metals respond to different chelators differently. So if someone has a high level of mercury or cadmium, you would need something, it's a medication called DMPS. If you have high levels of aluminum, lead, things like that, calcium EDTA, or even vitamin C is your way to go. Orally, we should all be taking something to chelate. I and my husband, we take chlorella every single day. We do things to stimulate our lymphatic system. That's just from a baseline things that you should be doing. But heavy metals is very, very, very important to get out of your system because you don't want that to accumulate and over time physically cause symptoms, whether it's with your brain, your kidneys, your heart, your liver, your gut.
And a lot of autoimmune issues, a lot of times, scientifically haven't always been linked to heavy metals, but even neurological issues, Alzheimer's, early dementia, like you said, fibromyalgia, other types of lupus, other types of conditions that might, be triggering from an overload of toxins in the body. And I think, knowing or not knowing, I think it's the not knowing for a lot of people that, and conventionally, a lot of doctors just don't test for these things. It's not something that they'll come in and say, well, you have this, let's give you this, because this treats, Alzheimer's, or this treats lupus, or this treats,
It's that Newtonian model where it's like you fall into this category, here's your medication, see you in a year. They don't ask the why. And not knocking conventional, I come from conventional, but they don't ask the why, and they don't want to understand the why. And then there's a lot of, we aren't trained conventionally to treat that why. So there are a lot of things that
so I think the prevention model, and also the betterment of evaluation and the treatment model could surely be more, like we use the word integrative. Like it doesn't have to be all one way. It can definitely be a combination of using conventional medicine. Listen, conventional medicine, urgent care, emergency medicine, acute situations, absolutely we need certain things. Just some of the the day-to-day, week-to-week.
We don't know what we're doing from a chronic illness standpoint.
Chronic, right. It seems like, and we mentioned the cardiovascular disease, right? The number one issue in our country, the diabetes, obesity, that's, and one's causing the other, basically, right? So you have those three things right there are, just killers and chronic health issues that we need to address. Then you can go into like your cancer states and other things, but, and we're not necessarily treating everything integratively, but again, supporting the body to help itself heal better. Right?
Yeah, again, we would never say we're treating you, we're curing you. We would say we are giving your body these beautiful tools to get into an optimal state of health, whatever that looks like for the patient. And for some people who have established chronic illness and they've had that for 10, 15, 20 years, that's not going to happen after 4 treatments. That's going to happen after a longer period of time. For a 25-year-old who, has a little bit of anxiety, gut issues, fatigue, that's going to look like a shorter period of time. So again, every case is so different. But in general, everyone should have an opportunity to return to a better state of health.
Yeah. I think back to your point, the youth versus, older chronic conditions, the longer things, are in your body and the longer they go unattended, it does take time for your body to reverse those issues. Yeah. And going back to like early in the show when we spoke about the labs, I think you made a good point, is that labs will tell you when something's gone really already wrong. And our ranges, are set by, certain standards of health that they're set in for a particular reason, right? They need to validate certain things in medicine, whether it's prescribing, statin drugs for high cholesterol. So if someone's 220 cholesterol and the doctor says, well, take a statin drug, personally, I wouldn't do it. I wouldn't tell the patient not to do that if the doctor recommended it, but personally, I wouldn't do that. I would go, hey, what can I do personally to get my cholesterol down to a normal and healthy level, because I know the statin drugs come with other, side effects, other issues, and again, the liver toxicity of taking medication. So we want to try and avoid those things, but the labs will, if you evaluate them as things are starting to creep up, you're like, hey, this is normal, but it's high normal. Like how do we get this so it's either, average normal or low normal, so we're not creeping up our H1C and things like that for pre-diabetics and stuff of that nature. So I think that's important. And then just working on the overall body. Now, vitamins is a big thing. So let's talk about like certain things like vitamin B, vitamin D. You hear a lot of news about low vitamin D in our bodies, and what does that entail? What do people experience if they have low vitamin D, and how would you correct something like that? Yeah,
so there's a lot of issues in general, not with just B and D, but other minerals, for instance. Minerals I feel like are never talked about, or other vitamins and things that happen in them. Even something like taurine, for instance, your body is supposed to naturally produce, but because of issues with liver function, which a lot of us have going on, and helps hugely internally. Same thing with glutathione. That is a major detoxing compounded medication that we can give patients that will not only help support liver function, but gut function, help detoxify, help internal terrain. Vitamin D is something that during the summer we tend to not see as many issues with it, but during the winter months can lead to, there's been plenty of studies about being linked to depression, anxiety, issues with bone density and bone formation, even muscle growth and tissue growth and repair, and your immune system. And in the winter, our immune systems are not usually doing too hot. B12 and the other B vitamins, which are never really talked about, B1 and B5 and B6, B3, B2 even, any B complex, we'll call it, has a lot to do with nerve, tissue, DNA, hugely important in cell synthesis, which then can lead to issues with, if you don't have enough of that, oxygenation, red cell formation. A lot of that has to do with gut issues. A lot of it has to do with muscle issues. So patients that have issues with whether it's myalgias or spasms or eventually leading to some type of tears or something of this sort. They all are hugely important. Any vitamin that we're talking about. Minerals, especially things like
trace minerals,
selenium, huge for thyroid health. Magnesium plays over 12 different roles in the body. But again, we're living in a world now where you're not really getting that from diet, from food, which is how we used to get everything from the earth, from all these lovely plants and veggies. That doesn't really exist too much anymore. So at a minimum, people should be taking something, whether it's trace minerals or vitamins, to replenish that at a minimum. The best thing, in my opinion, and everyone should be doing this by the time you reach like 25 years old and onward, some type of invasive therapy, whether it's injections or IVs, to replenish that too, because you're bypassing this when you do that. But, again, we are not really, as like you mentioned, society to do those things, because our paradigm doesn't focus on preventative health too often. It's, oh my gosh, I have all these symptoms, I have to go to my practitioner now. We are trying to, at Nusoma, do the opposite and get that ingrained in people's brains. It's okay if you have chronic issues and, you come to us to get those treated. Totally fine. It's just a little bit more backpedaling, but focus on prevention too. What can you do to prevent yourself from getting into a situation where you have all these skewed lab results, you have muscle pains or extreme fatigue or, IBS. Prevent yourself from getting there so you don't have to backpedal and you don't have to do more work and spend more energy and time. Just kind of nip it in the bud before it gets to that point. That's the paradigm that I think we all should live in.
And you mentioned the thyroid condition. I know tends to affect more females than males, but it does affect both. Being autoimmune, thyroiditis, Hashimoto's, hypothyroidism. A lot of times, that can be caused by environmental factors as well as other types of things. And then, treating a lot of times, they'll give Synthroid. Sometimes more integrative practitioners will prescribe like an Armour thyroid, but there's different models as to what caused these issues. And a lot of times
the root cause, the why.
The root cause, and why is that happening? And can you reverse thyroid or hypothyroidism, or can you just get the thyroid to kick in and start functioning a little bit better?
Yeah, again, it depends. So if you've had Hashimoto's or hypothyroidism for 20 years, I'm not going to reverse your thyroid condition. And hormones are the most challenging thing to deal with, even more so than something like Lyme to some extent. That can be, usually with thyroid, especially in females, has a lot to do with some type of viral infection, heavy metal toxins, and believe it or not, emotional stress. So at least from what I saw for the past 8 years, supplementation may push that, move the needle on the dial a little bit. But if you really want to get the thyroid up and working again and maybe start to hopefully titrate the medication that you've been on, especially if it's only been a couple of years, do something invasive, do something to support the thyroid from a natural way, whether that's vitamins, minerals, compounded medication. But it's something that, again, like anything, the shorter amount of time that you've had something going on, the easier it is to backpedal. And the number one thing that you should do is not have anything going on, nip it in the bud, and do it from a preventative standpoint. That's the number one thing.
Right. Now with Nusoma Health, your focus is definitely prevention and trying to get people to, treat themselves a little bit holistically, a little bit more with nutrition, dietary lifestyle changes. We spoke about these IVs a lot, and I know there's a lot of IV stuff out there. Just some of it I feel is a little bit just out there, and some of it is meant to be more clinical and more specialized and more personalized, like you said. Tell us about your approach to treating patients with IVs and your personalized approach to getting the right ingredients in for that particular patient.
Yeah, sure. So, so there's a lot of, when I start talking to people or patients about this, they say, oh, are you doing an IV hydration? But I just completely stop them before they even finish their sentence. No.
It's not a hangover bar.
It's not that's right. The other thing that everybody says. No, it's not a hangover bar.
Right.
So the purpose of what we're doing is, when you say personalized, again, that's how I was trained. You're an individual, so you should be treated as such. So even though we have standard IV treatments for programs, so for instance, we have a weight away, a stress less, a ProCharge, an immune system bag, a GI revive. If you come to me as a patient for an initial evaluation, you show me your lab work or you get it done, we do our whole, integrative assessment. I say, you know what, your kidneys and your liver are a little bit of a mess. I'm not going to give you X, Y, and Z ingredients. Instead, I'm going to swap them for this, and we're going to do these IM injections. Plus, I'm going to give you this amazing, what we call triplet oxygen therapy that enhances the inside of your body to detoxify and receive what I'm giving you much, much faster. The whole point of what I want to do, like I keep mentioning, is I want people to feel well. That's why we get into healthcare in the first place. I want people to be able to say, oh my gosh, I did XYZ series of treatments and I can finally get out of bed in the morning without a headache, or I can run again, or my lab values came back normal after 6 months. This is incredible. I've had these labs like this for 5 years. That makes me happy, and that makes me know that I did a good job, and that's what I want to do for people and patients. And it's totally possible. Hopefully, eventually, we'll be expanding with even more treatments that we can help people with. But there are so many things that people have no idea about and what they can do, and I want to help educate them on that.
And that's a great story. I like to hear about this, from practitioners, and I like the fact that you're, taking a different approach. If you could share with the audience, like I'm sure over these years you've had like just one wonderful experience with one of your patients. If it was a diagnostic issue or a health issue specifically, you can elaborate on it. And just obviously no names, but just just what they came in with, what their protocol was like, and what their end result was. I think people like to hear.
I have a lot of really cool stories.
Yeah.
We did over 74 different treatments at my old clinic, a lot of which were practiced abroad in Germany and Switzerland. So a lot of people have no idea what I'm talking about half the time. But there, I became very close with a family. We treated all of them, but their youngest son, he had really, really debilitating chronic Lyme. He just was a different person. Anxiety, ADHD, couldn't function, couldn't read. He had to get pulled out of school. Every symptom you could possibly imagine, literally, he had. And he was treated with this for, I guess, about probably 2 years on and off intermittently. And he went back to college. He's running again. He surfs. They were out in the Hamptons, out east. So he surfs now. He's dating someone who he's super serious with. I still keep in touch with them.
Right.
I love them dearly. It's incredible.
And the protocols were similar to what you're discussing.
Yeah, a little bit more,
little oxygenation,
right.
Maybe some other therapies.
A little bit more advanced, which hopefully we will do eventually. But no, it's so rewarding to see that happen, because someone who thought that at the age of 18 he lost his life, to be able to bring that back, that was a really cool experience.
Right. Well, I think if anyone learned anything today, it'd be listen, if you're suffering with chronic issues, whether it's fatigue or kind of mental sluggishness, and maybe sleep problems, and weight problems, and hormonal, and lose weight, and stress, all those basic things. I think that probably categorizes 60% of our population right off the bat. So 60% of you out there can probably benefit from these types of therapies. You start getting into some of the more specific issues like Lyme and some other things. Maybe a smaller percentage, but there's also probably a larger percentage of people that don't know that they even have some of these chronic issues until they're evaluated properly. Lyme is very sneaky and tricky, and a lot of times people don't even know that they may have a chronic Lyme issue. It gets into the neurological system, it affects their joints, it affects their neurological system, their cognitive function, all the above. So those are other things that you can look at. So symptoms lists and checklists are important, but then using the right diagnostics, trying to find the kind of the pieces of the puzzle, putting the puzzle back together, getting everyone to feel better, and I think that's what you do as a practitioner. So I think that's really wonderful. I want to thank you so much for being on the show today. A lot of great information, and I think we'll have to bring you back, because there seems like there's a lot more we could probably talk about.
Sure.
We're limited on time today, so I want to thank everyone for joining us today for Health IQ. I'm Dr. Alan Siegel. We'll see you at our next show. Thank you. Bye-bye.